In Hawaii, we have a unique program. As a senator, though, as the only physician senator here, I felt very compelled to make it easier to bring doctors into Hawaii, especially into our rural areas. We have a serious physician shortage in the state. We're about 600 or 700 physicians short statewide, and we're a pretty small state, so that's that's significant. So finally, this past year, just in May, when we finished the legislative session, we finally passed the loan repayment bill, which what it does is Hawaii now will get dollar for dollar matching from the federal government for loan repayment to any primary care physicians. And if you come in as a primary care person, whether that's pediatrics, family practice, internal medicine, and we're going to be expanding some of these criteria, and also nurse practitioners, by the way, we will pay back all of your medical school debt over the course of a few years, about $30,000, $35,000 a year. The private sector can contribute to this. Of course, the government's contributing money. I already raised $300,000 with some of my more well-heeled friends, and that comes with a match from the federal government. We're going to ultimately pump that up to many millions of dollars so that Hawaii will be the state where if you want to practice in primary care, you will be able to do it and have your loans forgiven. The reason for that is that number one, in Hawaii, the salaries sometimes are a little bit lower than on the mainland, so it's hard for us to attract doctors from, I'd say, Texas or Pennsylvania or California. Also, when you're working in a rural setting, there aren't some of the perks that people have become accustomed to, very fancy schools, theater, a lot of the things that families want when they've gone through a lot of education and they're settling down. So by doing loan repayment, it's an incentive for us to be able to recruit docs. Also, my personal agenda is to have a more robust primary care workforce, because if we have more primary care providers, physicians specifically, then we do more preventive health care. People don't have as much end-stage disease. They actually do better, and the costs come down, it turns out, in our healthcare system, something that we're all aware has to happen. So that was probably the biggest and most important bill we passed this year. It doesn't light up, it's not like fireworks. People don't see it that way like some of our other legislative issues. But when you consider that we are not going to have a shortage of physicians in 10 years, it's a really great thing. And it is going to be an opportunity for someone who might see this clip and say, hey, that's great. Hawaii's going to be one of those states where I can repay my loans. And so I'm real optimistic about its impact.